सबक्लेवियन आर्टरी आपके पास डिपेंड करता है कि राइट साइड की या लेफ्ट साइड की. लाइक इफ इट्स योर राइट सबक्लेवियन आर्टरी, तो राइट सबक्लेवियन आर्टरी इट अराइजेज फ्रॉम योर ब्रेकियोसेफेलिक ट्रंक. But if it's your left subclavian artery, then left subclavian artery arises directly from your aortic arch. aortic arch की तीसरी ब्रांच आपके पास लेफ्ट सबक्लेवियन आर्टरी. सो इट डिपेंड्स कि आपके पास राइट साइड की सबक्लेवियन आर्टरी है या लेफ्ट साइड की सबक्लेवियन आर्टरी है. Subclavian artery, it is divided into three parts according to your scalenus anterior muscle. So this is your scalenus anterior muscle that is inserted on your first rib. So this is the almost the lateral border of your first rib. तो आपके पास till from the continuation from the origin of subclavian artery till the medial border of scalene anterior muscle आपके पास होगा ये पहला part. The part that is behind this muscle, that is your second part, and the part that is after from the lateral border of this muscle till the lateral border of first rib, that is going to be your third part. क्योंकि lateral border of first rib को जैसे ही cross करेगी then it will become your axillary artery. Now this second part of your subclavian artery, it is in a triangular shape alongside your brachial plexus, and this triangular space, it is your interscalene triangle, right? This is the triangle. इसके anterior side पे आपके पास anterior scalene muscle होगा, posterior side पे आपके पास middle scalene muscle है आपके पास, and inferiorly we have your first rib. और इसके content क्या है हमारे पास? Brachial plexus and our subclavian artery, right? So brachial plexus and our subclavian artery. अब तीन पार्ट्स में हमने जब डिवाइड किया इस सबक्लेवियन आर्टरी को, इन्हीं तीन पार्ट्स के अकॉर्डिंग हमारे पास कुछ ब्रांचेस निकल रही हैं. पहले पार्ट से आपके पास आप देख सकते हो, यू कैन ईजीली अप्रिशिएट देयर इज थ्री ब्रांचेस दैट इज कमिंग आउट फ्रॉम द फर्स्ट पार्ट ऑफ सबक्लेवियन आर्टरी. द फर्स्ट ब्रांच, इट इज़ योर vertebral artery, and it is going to supply your brain and your spinal cord. The second is your internal thoracic artery. As you can see here, it is internal thoracic artery. This internal thoracic artery is going to supply your anterior chest wall. It is going to supply your breasts, right? It is going to supply your upper anterior abdominal wall as well. So anterior chest wall and anterior area of your body, it is supplied by your anterior thoracic artery. The first was your vertebral artery, and you have this very important artery. This is your thyrocervical trunk. Now this thyrocervical trunk is very important because this thyrocervical trunk is itself divided into four branches. इसके पास चार branches हैं आपके पास. एक ये branch जो आपके जा रही है, this branch is your transverse cervical artery, right? It is your, यहाँ पे लिख लेता हूँ, first branch is transverse cervical artery. Second is your suprascapular artery. So this is your suprascapular artery. Suprascapular artery. And these two branches of your thyrocervical trunk are very important क्योंकि ये आपके पास anteriorly move कर रहे हैं from your scalene anterior muscle, right? And these are very important because ये anastomosis around your scapula में participate कर रहे होते हैं, right? Your transverse cervical artery have a deep cervical branch that moves around the medial border of your scapula. And suprascapular artery, it moves posterolaterally, पीछे side में, as you can see, easily appreciate, it is going posteriorly and on the lateral side. Posterolaterally, पीछे वाली side पे and lateral side पे, and it will be this suprascapular artery, it will be supplying your supraspinatus and infraspinatus like fossa of your scapula. तो posterolaterally it is moving. बाकी दो branches आपके पास inferior thyroid artery है. Inferior thyroid artery है, you can easily appreciate, this is your inferior thyroid artery. This artery is going to supply your thyroid gland, larynx, trachea, esophagus, etc. Then there is a fourth artery, that is your ascending ascending cervical artery. This is your ascending cervical artery, and it is going to supply, of course, your brain area, the deep muscles of the neck, and your spinal cord. So ये आपके पास था first part of your subclavian artery in all their branches. Baki second part of that is behind this scalene anterior muscle. This second part is because क्योंकि behind है इस muscle के, तो हम देख नहीं कर सकते, लेकिन इसका major जो आपके पास इसके जो branch निकल रही है, that is your costo-cervical trunk. This costo-cervical trunk has some branches. We have deep cervical artery that is going to supply your deep muscles of neck. So we have two branches. Costo-cervical trunk, we have deep cervical artery that is going to supply your deep muscles of the neck, and we have superior intercostal artery. This superior intercostal artery, it is going to supply your first and second posterior intercostal spaces, right? So दिस इज़ योर पीछे वाली साइड पे अगर हम इसको निकालेंगे तो हमें किस तरह से नज़र आएगा, ये आपको सबक्लेवियन आर्टरी, उसकी एक ब्रांच होगी, दैट इज़ योर costo cervical trunk, and this costo cervical trunk will be divided into two main branches. These two main branches are superior intercostal artery and deep cervical artery. जो थर्ड पार्ट है आपके पास subclavian artery का, that is starting from your lateral border of scalenus anterior and till the lateral border of your first rib. This third part, right, of your subclavian artery, क्योंकि थर्ड lateral border of first rib के बाद आप इसको नाम दे दोगे axillary artery. We have one important branch here you can easily appreciate. This is your dorsal scapular artery. This is your dorsal scapular artery. This dorsal scapular artery will be supplying your rhomboids and levator scapulae and some part of your trapezius as well. And it will be on the medial border of scapula, and this dorsal scapular artery, it will be doing anastomosis with your superficial cervical artery, right? जब आपके पास हमने एनास्टोमोसिस अराउंड स्कैपुला हमने डिस्कस किया था, तो हमने कहा था कि जो ट्रांसवर्स सर्वाइकल आर्टरी है, इसी की एक डीप ब्रांच होती है, इसको आप कहते हो डीप ब्रांच ऑफ सुपरफिशियल सर्वाइकल आर्टरी, राइट? दिस डीप ब्रांच ऑफ सुपरफिशियल सर्वाइकल आर्टरी विल डू एनास्टोमोसिस विद योर डॉर्सल स्कैपुलर आर्टरी, राइट? सो ये आपके पास वेरी इंपॉर्टेंट है फॉर द एनास्टोमोसिस अराउंड योर anastomosis of your shoulder joint, anastomosis around your shoulder joint.